Thanks for having me.
Let's talk about a comment you made the other day that grabbed some attention. You talked about the Democrats who voted for the Upton bill, the Keep Your Health Plan bill. You said most of them, 39 of them, were merely insulating themselves for primary season. Do you really believe that they didn't have principled disagreements with what's happening in the Affordable Care Act?
Well, thank you so much for having me. What I said was several of them that I spoke with were, in fact, insulating themselves from sound bites. I think we all know that up here, one of the real dangers is to lie in the fact that people are really afraid of these little poison pills that get stuck in various bills. In the Upton bill, although it talked about people being able to hold on to their policies if they liked them, it also said in the second part that the insurance companies could continue to sell substandard policies. Now, every Democrat I know was against that, but the first part of that would end up in a soundbite when they're out there running for re-elections, and so a lot of them felt that they needed to insulate themselves. Not everybody. Remember, in the first place, about 32 or 34 members voted against the bill way back when we first passed the law.
But Congressman, maybe those members of Congress are just in step with the American public. If you look at the new Gallup poll that's just come out, the numbers of people who think that health care is a government responsibility, as we said earlier, has declined significantly. Clearly, Americans just don't think government is able to run this thing. So maybe those members who voted for the Upton bill were just reflecting what their constituents are thinking.
No, I think that may be current thought among some people, but Social Security seems to be run pretty well to me. Medicare runs pretty well. The Veterans Administration runs pretty well. So the government can, in fact, run big programs. And when the American people had an opportunity to let their feelings be known as to whether or not we should privatize Social Security, they said with a loud, resounding no. We do not want to see Social Security privatized. So they must want the government to run it. So we are having a rollout problem. I think it will get fixed. I think the Affordable Care Act, allowing people to stay on insurance policies once they get sick. I think the real big problem to American people is for you to pay your premium for decades, and all of a sudden something shows up on your x-ray, or you go for your second treatment and you get a letter from the insurance company canceling your policies. Cancellation letters are not new. Ever since I've been in the Congress for 21 years, I've been hearing from my constituents about getting cancellation letters from insurance companies as soon as they got sick or because they've reached some limit for the year or for their lifetime. So I think that we ought to keep plugging along, get this thing fixed, and I think the American people are going to like the Affordable Care Act once they get a chance to use it.
Chuck Todd, Congressman just touched upon a reality that has affected millions of Americans over the years, and that is the insurance company's role in the deliverance of health care. No matter whether you have a basic bare-bones plan or a Cadillac plan, you feel the hand of the insurance company at some point during an illness or a hospital stay. Is the White House at all concerned? What's the level of concern, if any, that they have about the alliance that they created, the marriage that they have formed between the insurance companies and the federal government, you know, the ACA, in order to get something done? Are they at all concerned about that?
Not anymore. I mean, this is the deal they made. I mean, this is the decision they made at the beginning when they decided to build on the structure of what we have versus trying to create a new structure, trying to, you know, create a new way, maybe even getting rid of employer-based insurance. And when that decision, you know, was made, and part of that had to do with politics, the insurance companies basically torpedoed efforts to reform health care in the 90s. And so this time, if you can't beat them, join them. They made that decision. Now, Mike, I think, you know, they're in bed with the insurance companies. And I think this is you can tell it's an uneasy alliance. I can tell you that the White House is disappointed that the insurance companies aren't promoting health care reform more. And we did an examination of this yesterday on my show about the lack of. It's been amazing.
Sure.
how little insurance companies have done to at all promote the law, and you would think it's good business for them to. Now, of course, part of that could be that there's no website to point to.
Oh, they're not surprised by it, I hope.
No, they're not surprised, but I think that they're disappointed that the health insurance companies aren't more publicly enthusiastic, since this law was essentially designed to give them more business.
Congressman, this is Nicole Wallace. I wonder, what could the White House do to make your job easier?
Well, I think we got to get the website fixed. But I really believe, and I argued this early on, that we need to push this out into the insurance companies. If we are going to be in bed, let's bring them into this process, because a lot of these insurance companies could be signing people up. They could be informing their policy holders. This letter that they're sending out, don't just cancel the policies. Let them know what the alternatives are. You are going to benefit from this in the long run because you're going to get more business. So you ought to be saying to your policyholders, these are the alternatives. The policy you've got, it will not cover a child born with diabetes, or it has a lifetime limit that you may not be aware of. So here's what the alternatives are and how we can make your life much better and can sell you a policy that may even be cheaper and will cover more. I think that burden is on the insurance companies, and they ought to go out and sort of man and woman up and get it done.
Hey, real quick, Chuck, it's Donnie. We're a few days away from December 1st, the next line in the sand.
Right.
Behind the doors of the White House, are their knees a little jittery, or, really do they think there's going to be a turn there?
I would say it's somewhere in between what you just said. I mean, they're jittery. They know that everything is on December 1st, November 30th and December 1st for it to work. There is more optimism. I think they think that it is going to be a working website. Now, this time it seems that they learned their lessons about expectations, and they're trying to sort of tamp things down. So they don't mind the articles that are out over the last 48 hours that say, oh, maybe only 4 and 5 will be able to have a success, or maybe they'll find other ways that they're trying to, for once, under-promise. We'll see.
And they'll have to explain, too, the findings on the front page of the Washington Post this morning that say they knew about these problems with the website back in March. Congressman Jim Clyburn, always love having you on the show. Appreciate your time this morning.
Thank you so much.
And